I don't want to sound like a broken record, but Medicaid expansion in Virginia, we have more than 50,000 Virginia veterans who have no insurance, whether through the VA, private insurance, or through Obamacare yet. And we need to expand Medicaid in Virginia. But we also need job training for the healthcare jobs of tomorrow and the healthcare jobs of today. Further, 8A programs are not only for traditional minorities, but also for service-disabled vets. And we need to increase those, the portion of that program that's set aside for service-disabled vets. That's what I would do.
Thank you. Mr. Levine.
This is a great question. How do we help veterans come home and get jobs? And how do we do it in a way that saves us money? There's actually a pretty simple way to do it. Veterans, when they're around the battlefield, Iraq, Afghanistan, they learn all kinds of very useful techniques they can bring home with them. Emergency medical technicians, helicopter pilots, aircraft maintenance, and so forth. Then they come home and they want to be a helicopter pilot, and they say, oh, I'm sorry, sir, or ma'am, you need a 2-year certification program. And she says, but I was a helicopter pilot in Afghanistan where we were shot at. I think I can handle it at home. And they say, well, that's the regulation. It would be very simple, and President Obama is with me on this, to have veteran certifications designed by veterans for veterans, where they learn, oh, the 2 months perhaps necessary to learn the difference between a military helicopter and a helicopter here at home, instead of the 2 years to relearn everything. That not only helps the veteran, who only has to study for 2 months and then gets out there in the workforce, it helps the government, because we save money on a 2-year program we shouldn't have to pay for. On health care, we should allow veterans to get automatically signed up for the VA. I don't know why they're not automatically signed up. I don't know why we have voters who are automatically signed up for voter registration. We need to get the paper out of the system and get it into electronics, because the paper is building up, and I could go on, but I have to stop.
Mr. Beyer.
Well, I'm sorry that some here choose to misinterpret the poverty reform that we did in 1995. We worked very hard structurally to lift people out of poverty. I'm sorry that subsequent General Assemblies haven't funded the investments that we made in children and in mothers who are on TANF. I ran years as hard as I could for governor so that I would be able to submit a budget that would do that. I lost, but I haven't stopped fighting to lift people out of poverty in everything that I've done. On veterans, I totally agree with Senator Ebbin. We need to expand Medicaid. That will help 50,000 veterans here in the United States. And we need to pay attention to the hearings on the Veterans Affairs. It's just unconscionable that these folks coming back, not just from Iraq and Afghanistan, but from Vietnam too, all these years later, can't get basic appointments for Veterans Affairs. We need to fix the appointment system, we need to fix the backlog, and we need to invest in VA hospitals. And how would I pay for it? The very first lowest hanging fruit is, let's not spend $20 billion modernizing nuclear weapons that we will never use.
Thank you.